Hello and welcome back to Neo Psychology with me, your teacher, Mr. Neo, the channel where I teach online psychology lessons to my wonderful students. Today we're looking at the schizophrenia unit. We're looking at lesson 9, biological therapies, drug therapy evaluation. Last lesson we had a look at drug therapy. Now we're going to evaluate it. What are the strengths and weaknesses essentially? Okay, starter. Biopsychologists are a big advocate for drug therapy, using antipsychotic drugs as treatment to reduce the symptoms of mental disorders such as schizophrenia. But what do you think are the strengths and weaknesses of using antipsychotic medications as a means of treatment? If you had a mental disorder, would you opt for drug therapy or an alternative type of treatment? What would you do? Are you perfectly willing to take medication? I know myself, where possible, I prefer not to take any sort of drug medication. And I try and do more natural treatments, or alternative treatments. Maybe talking therapy. Being a psychology teacher, I love psychology and I love the power of talking therapy. And I think that's a lot more, it could potentially be a lot more effective and treats the origin of the issue rather than drugs which treat the symptoms. But that's just my opinion. What's your opinion? Let's crack on, shall we? What are we doing today? So today we're going to recap a little bit on drug therapy, and we're going to I'm going to give you a question to answer, and then we're going to discuss and evaluate drug therapy. It's not going to be a long one today. Let's start with learning objective 1. Drug therapy recap. So, got some definitions here. Drug therapy and antipsychotics. Drug therapy involves treatment of mental disorders, I'm doing it myself, such as schizophrenia, through the use of antipsychotics to reduce the symptoms of the disorder. Antipsychotics are drugs used to reduce the intensity of symptoms, in particular the positive symptoms of psychotic conditions like schizophrenia. There we go, lovely, did it. Drug therapy and antipsychotics. And as we know from last lesson, there are 2 types of antipsychotics. What are they? Typical and atypical. Nice one. Right, here we go. Research methods. Clozapine. Clozapine is estimated to be successful in 30 to 50% of cases where typical antipsychotics have failed. Okay, good. Question. Outcome studies like this generally use independent groups design. Explain why this is a good idea. Ooh, research methods. Okay, what's the independent groups, right? Repeated measures is when individuals repeat the one group repeats the different conditions lots of times. Independent groups is when what? One group does one condition. Okay, why might that be a good idea? 2. If you were to design an experimental study to test the effects of clozapine on schizophrenia, how could you control for confounding variables? How would you do that? Number 3, explain what is meant by the term demand characteristics. What is demand characteristics? As you know, research methods can come in any module, in any paper, not just paper 2 where there's specific questions for research methods. Research methods questions can come throughout all 3 papers. And extension, how could you eliminate the effect of demand characteristics in this study? Good questions, interesting questions. Pause the video. Give it a crack. Don't be lazy, because I'm going to give you the answer now. Number 1. Outcome studies like this generally use independent group design. Why is this a good idea? The use of independent groups is a good idea because the alternative would be repeated measures where you give someone clozapine for a period of time and then don't give them clozapine. The problem with that is that the first condition, giving clozapine, would have an effect on the second condition. All right, there might be remnants of the drug still in you, and it'll be difficult to differentiate between what is the result of the drug and what's the result of not taking the drug, and which one's doing which. If you were to design an experimental study to test the effects of clozapines, how would you control for confounding variables? Well, there's loads of confounding variables. To control confounding variables, it would be a good idea to match participants on criteria such as age, severity of symptom, other disorders present. Okay, all of these things might affect the the strength or the usefulness of this medication. 3. Explain what is meant by the term demand characteristics. Demand characteristics are where the participants may guess the aim of the study, so their behavior changes, which may help or hinder the psychologist's results. Yes, right? Is changing your behavior in any way that isn't the way you would normally act, right? It might be in a way that they think the psychologist wants them to act, or the researcher wants them to act, or they might do the opposite. They might act in a way that they think the psychologist doesn't want them to act. Either way, they're not acting themselves. They're not acting naturally. And then extension. How could you eliminate the effect of demand characteristics? Demand characteristics could be reduced in this study by either using an independent measures design, so one group of participants is given clozapine and the other no treatment, or by using a double-blind procedure where neither the participants nor the researcher knows which group have given the atypical antipsychotics. Okay, that actually reduces researcher bias as well. Okay, so we had a little recap, had a little question, a research methods question on drug therapy. All we've got left to do now is evaluate it. What are the strengths? What are the weaknesses? Okay, identify one thing you learned about drug therapy last lesson and maybe this lesson. Why do you think learning about drug therapy is important? It's important to know about this stuff. People, you will know people. You might not know that they take antipsychotic medication, but you will probably know people that take antipsychotic medication, right? And it's important to know how it works. It's important to know how any medication works. Even paracetamol has some side effects, and to understand how paracetamol works or how any medication works that you're taking is important. How does drug therapy apply in real life? All of us have taken medication in some way or form in our lifetime. Okay, so that's how it applies. Understanding how it works, though, is the next step, and I think it's really important. What questions has drug therapy raised for you? What are you still wondering about? Have you got any more questions? If you do, let me know. I'll try and answer them for you if I know. Or ask someone else in class. They're well smart. Right. Here we go. Learning objective 1 is complete. Show comprehension and recap knowledge of drug therapy. We're moving on to learning objective 2, right? Evaluation. To be able to discuss and evaluate drug therapy. Probably could have got the last 2 lessons into one, but I don't think it's good to smush them all together. Yes, smush. Okay, discuss and evaluate drug therapy. What are some of the strengths and weaknesses of drug therapy? Can you come up with any of your own, right? What are some of your own ideas on why drug therapy is good or why drug therapy is bad? Okay. Evidence for effectiveness. Think about, is this a strength, is this a weakness? There is a large body of evidence to support the idea that both typical and atypical antipsychotics are at least moderately effective in tackling the symptoms of schizophrenia. Ben Thornley et al. In 2003 reviewed studies comparing the effects of chlorpromazine to control conditions in which patients received a placebo, so their experiences were identical except for the presence of chlorpromazine in their medication. So they got 2 groups. The control group took the placebo, which would have been a pill with no active ingredient. Data from 13 trials with a total of 1,121 participants, so low, that's a massive sample, showed that chlorpromazine was associated with better overall functioning and reduced symptom severity. So the people that took it had better functioning in general, could be cognitive, just could be functioning in real life, and they had reduced symptom severity. Their symptoms were a lot less severe and their symptoms were reduced, possibly symptoms of hallucinations and delusions. Data from 3 trials with a total of 512 participants showed that relapse rates were also lower when chlorpromazine was taken. So it helps reduce the symptoms and improves overall functioning, and it also reduces the chance of a relapse. A relapse meaning that you have like a breakdown and possibly the symptoms become more severe, and it reduces the chance of a relapse as well, which is brilliant. In addition, there is support for the benefits of atypical antipsychotics. In addition, Herbert Meltzer concluded that clozapine is more effective than typical antipsychotics, and other atypical antipsychotics, and that it is effective in 30 to 50% of treatment-resistant cases where typical antipsychotics have failed. A number of studies have compared the effectiveness of clozapine and other atypical antipsychotics like risperidone, but results have been inconclusive, perhaps because some patients respond better to one drug or the other. It does seem, though, that antipsychotics in general are reasonably effective, and this is a strength, of course. Yeah, this makes sense. So what this means is they're quite effective. Right? There's lots of evidence for the effectiveness of these antipsychotics, the evidence for the effectiveness of chlorprozamine, clozapine, and risperidone, and how they are really effective. Therefore, it's a great therapy. Drug therapy is really effective. Those people with schizophrenia, all of them will be taking some form of drug therapy. So it's effective, it's really effective, and there's evidence to support that. Otherwise, psychiatrists, who are proper doctors, wouldn't be prescribing it. So there's a strength. There's effectiveness. There's evidence for the effectiveness of these antipsychotic medications. However, side effects. A problem with antipsychotic drugs is the likelihood of side effects, ranging from the mild to the serious and even fatal. Typical antipsychotics are associated with a range of side effects including dizziness, agitation, sleepiness, stiff jaw, weight gain, and itchy skin. Long-term use can result in tardive dyskinesia, which is caused by dopamine supersensitivity and manifests as involuntary facial movements such as grimaces, blinking, and lip smacking. Is it that? Is that lip smacking? I don't know. The most serious side effect of typical antipsychotics is neuroleptic malignant syndrome, NMS. This is believed to be caused because the drug blocks dopamine action in the hypothalamus, an area of the brain associated with the regulation of a number of body systems. NMS results in high temperature, delirium, and coma, and can be fatal. Yeah, that's a bad side effect, a coma. A typical dosage of antipsychotics have declined. NMS has become rarer. Estimates of its frequency range from less than 0.1% to just over 2%. So it's quite a rare thing to come about now. Atypical antipsychotics were developed to reduce the frequency of side effects, and generally this has succeeded. However, side effects still exist, and patients taking clozapine have a regular blood test to alert doctors to early signs of arangulocytosis, which is that blood condition that could potentially kill you. Side effects are thus still a significant weakness of antipsychotic drugs. Loads of weaknesses. So is this a strength or a weakness? Well, this is clearly a weakness. This is a very bad thing to happen as a result of drug therapy. I'll give you one example, actually, the one that the book won't tell you, the one that we won't teach you about. One of my patients, he came to me and he goes, I've got one of my side effects of taking the medication that I'm taking is I can't climax when I have sex or when I masturbate. I was like, okay. And he was like, yeah, I'm doing it for hours and I can't climax, and it's one of the side effects of the medication. And you don't think about those type of things as well, right? These side effects are not just physical things like sleepiness or stiff jaw. They're like social potential issues as well, you know, where it might have difficulties if you're trying to have a relationship, potentially. There we go. Might cut that out, I don't know. Use of antipsychotics depends on the dopamine hypothesis. This is more a theoretical issue than a practical one. Our understanding of the mechanism of antipsychotic drugs is strongly tied up with the dopamine hypothesis in its original form. Remember, this is the idea that there are higher than usual levels of dopamine activity in the subcortex of the brain. There is, however, quite a bit of evidence to show that this original dopamine hypothesis is not a complete explanation for schizophrenia, and that in fact dopamine levels in part of the brain other than the subcortex are too low rather than too high. If this is true, then it is not clear how antipsychotics, which are dopamine antagonists, can help with schizophrenia when they reduce dopamine activity. In fact, our modern understanding of the relationship between dopamine and psychosis suggests that antipsychotics shouldn't work. This has undermined the faith of some people that antipsychotics do in fact work. So, is this a strength or a weakness? This is a weakness. Right? The dopamine hypothesis is one explanation. There's other explanations. There's other biological explanations, and there's other psychological explanations for schizophrenia. Problems with the evidence for effectiveness. As we saw as our first point, there is lots of evidence for the effectiveness of antipsychotic medication. Although there is an impressive mass of evidence to support the effectiveness of antipsychotics, there have been some vigorous challenges to their usefulness. David Healy has suggested that some successful trials have had their data published multiple times, exaggerating the evidence for positive effects. Healy also suggests that because antipsychotics have powerful calming effects, it is easy to demonstrate that they have some positive effects on patients. This is not the same as saying they really reduce the severity of psychosis. To make matters worse, most published studies assess short-term benefits rather than long-term benefits and compare patients who keep taking antipsychotics with those suffering withdrawal having just stopped taking them. So what this is saying is, how effective are they really? Yeah, they've shown to be effective, but we know that they have sedative qualities as well. They have calming effects. Maybe the fact that they're just making people calmer is what seems to be reducing the symptoms, but isn't actually reducing the symptoms at all. It's just making people calmer. Question: what do these issues suggest about the effectiveness of antipsychotics? This is clearly a weakness. Problems with evidence for effectiveness. What do these issues suggest about the effectiveness of antipsychotics? The issues suggest that antipsychotic drugs may not be as effective after all. At least there is less evidence for their effectiveness than we might suppose. It may be the effect that their effectiveness has been exaggerated by drug companies who fund quite a lot of the research, and more independent research is therefore needed. Okay, the chemical kosh argument. It is widely believed that antipsychotics have been used in hospital situations to calm patients and make them easier for staff to work with, rather than for the benefit to the patients themselves. Although short-term use of antipsychotics to calm agitated patients is recommended by the National Institute for Health and Clinical Excellence, this practice is seen by some as a human rights abuse. I've seen firsthand this, in my opinion. I've seen it where the medication sedates and, for want of a better phrase, mongs them out, okay? You can see they take the medication and they're sat, and sometimes the patient just sat there on the sofa, just like that, watching TV, and just drooling, coming out like that. You go look at them. They got none of their symptoms, no hallucinations, no delusions. They got nothing going on. What's wrong with you? They're not got no symptoms. They got nothing going on. They're barely human at the moment. They're just sedated to the point where they're so tired and exhausted that they can't even be bothered to get up and succumb to any of these hallucinations, delusions. Is that really the medication that we want? Is that really reducing the symptoms, or is it actually just making them so exhausted that they can't be bothered to do anything? How serious are the ethical issues associated with the use of antipsychotics to calm agitated patients? Of course there are ethical issues here. Think about it. What are the ethical issues? Is this a strength or a weakness? This is a weakness, of course. Drug treatments have been nicknamed chemical straitjackets or chemical lobotomies. Lobotomy is a really old-fashioned surgery where if you were usually a mental patient and you were quite difficult, they would literally do brain surgery on you and lobotomize or cut a piece of your brain out to make you more easier to manage, more easy to deal with, right? One Flew Over the Cuckoo's Nest, if you've seen it, is an example of it. Effectively, what this means is rather than having therapeutic value and curing symptoms, they reduce the patient to a calm, zombie-like state. This could be considered unethical as it is effectively controlling their behavior. However, it might be considered necessary to keep the patient from harming themselves or other people. Drugs can be said to be dehumanizing as they take away individual personal responsibility and control when they may not have consented to treatment, as they may not be in a position in a psychotic state to give consent. And if they are sectioned, then treatment can also be enforced. When I worked in the mental health hospital, it was enforced in the sense that if you wanted your freedom, if you wanted to be allowed outside of the confines of the hospital, you had to comply with your medication to be given that ability to leave and potentially go and see your family or walk outside of the mental health hospital. And there we go. Outline one strength and one weakness of drug therapy as a means of biological therapies of schizophrenia. Answer the question in a Peel paragraph structure. Give your point. What's the point? Give the evidence, the piece of research to back it up. We're not an American president. We don't make points without evidence. And then explain what this means. Relate it back and then link it back to the question, okay? Peel your paragraph structures. Okay, give that a go. One strength and one weakness. Give yourself 5 minutes. Okay, and that's the evaluation of drug therapy. Okay, identify one thing you learned from the evaluation. Why do you think learning about the evaluation is important? It brings up the ethical issues. It gives you a better understanding, you know. These drugs, they're really effective. Yeah, they are in some cases, but are they just sedative, right? That's what we need to think about. What are the ethical issues because of this? How does the evaluation apply in real life? And what questions has the evaluation raised for you? What are you still wondering about? Are you wondering about anything? Let me know. There we go. I'm done with learning objective 2, to be able to discuss and evaluate drug therapy. We finished it. Let's move on to the plenary now. I've got a few multiple choice questions. I believe there's 6. Number 1. What explanation for schizophrenia are antipsychotics most strongly linked to? A. The subcortical hyperdopaminergic theory. B. The cortical hypodopaminergic theory. C. Neural correlates. Or D. The genetic basis of schizophrenia. I'm going to go for hyperdopaminergia. A. Good. I'm doing well. Are you doing well? That's what matters. Number 2. Which of the following distinguishes atypical psychotics from typical? A. They are all more effective. B. They have fewer side effects. C. They are taken in higher dosage. D. They act on just the dopamine system. What do you think? It's not C or D. They are all more effective. I don't think they're all more. They're possibly more effective, but they have fewer side effects. I'm going to go for B. Yes! Did you say B? Liar. Number 3. Generally, antipsychotics act on which neurotransmitter system? A. Serotonin. B. Glutamate. C. Dopamine. D. Cortisol. Easy. Dopamine. You should have got that one. You didn't. You're a noob. 4. A symptom of neuroleptic malignant syndrome is what? Which one of these is a symptom? A. Weight gain. B. Facial twitching. C. Dizziness. Or D. Delirium. Oh, I believe it was... What do you think? I think delirium. But I'm tempted by dizziness, but I'm going to go delirium. Yes! Number 5. Which of the following best describes the effectiveness of antipsychotics? A. There is no evidence for their effectiveness. B. Antipsychotics are associated with symptom reduction. Yeah. C. Antipsychotics are associated with improved overall functioning. D. Antipsychotics are associated with improved function and symptom reduction. I think D. Yes, good. So they improve functioning and reduce symptoms. And the last one, number 6, what is the problem with evidence for the effectiveness of antipsychotics? A, some data has been published several times. B, antipsychotics may make patients simply appear better because they have a calming effect. C, most trials look at short-term effects, not long-term effects. And D, all the above. It's always all the above. Okay, there you go. How many did you get out of 6? How many questions did you get correct out of 6? Are you an absolute legend? Did you get 6 out of 6? And there you go. There's today's lesson. Thank you for joining the lesson. Today was lesson 9, biological therapies, drug therapy evaluation. Be sure to submit your notes for this lesson. Well done, my neuropsychologist. Great job today. Keep up the good work. I've been Mr. Neo. God bless and peace.
I'm feeling like Will. I feel like a prince. I'm feeling myself. I'm loaded with bills, cause I wasn't blessed with no Uncle Phil. Don't know how it feels. I wanted to flex, they told me to chill. I'm making a flip. My life is a flick, now load up the film.